Hey guys, it's Debbie, and today I want to talk to you about what is happening in our dental world today. Yes, you all know there's a pandemic and we were shut down and we're all struggling. However, many dental offices are thriving. Those that have dental hygienists back working have another challenge, and that is getting all of their patients back onto their schedule. So I have created a special process that helps you get patients back onto the schedule. I will tell you about this shortly, but first, if you want the easiest path to create this type of success with patients coming back, I do want to invite you to schedule a 30-minute revenue recovery session with me. It's no cost to you if you click the link. So what's happening is that you don't have appointments on your hygiene schedule until September, October. It's everyone I talk to that has this situation, if they're able to have hygienists working in the practice. So what I want you to do is run a report of all perio patients. Those are your patients, all of them who have had a 4,000 code in the CDT 88 codes. And I want you to look at those patients. Now, I have a way that I can easily click on a button and share with you who are those patients. Many, as I'm working with our clients currently, not only do they need perio maintenance, or maybe they need scaling and root planing appointments and they haven't been able to schedule them, but these patients also have outstanding restorative care that's been diagnosed. And it's like 6 months since that original diagnosis was made. So what I want you to do is first run that report of all perio patients, anybody who's had the 4,000 codes. So now they need perio maintenance. Some of these patients have had a diagnosis for scaling and root planing. Maybe they went through gingivitis, and we want to get them back on the schedule. We know they had active disease, and the likelihood of this recurring without being seen in the last 6 months is great, even if it's 3 months later and they're overdue for perio maintenance. We know that periodontal disease is episodic and it's cyclic. So we want to get those patients back. But here's the other news, is that many of these patients also have a treatment plan. So I want you to do a search. I, second of all, want you to call and express concern. That doctor is concerned that they haven't been able to get back in due to this situation in our world. And we want doctor to reevaluate the situation. Now, most dentists that I talk to have appointments available on their schedule. However, the hygiene appointments are full until September, October. So these patients, they have gone through perio treatment, one of the 4,000 codes, and they also have restorative care. So they're going to come back for doctor. Many of these patients need bite wings. They need full mouth series. So you're going to schedule at least 30 minutes so doctor and the assistant can take these radiographs and doctor can reevaluate. When doctor's reevaluating, they're going to check, do they have a healthy mouth or do they have active disease? Do they need a perio maintenance appointment or gingivitis? Do they need a prophy? Now, I'm telling you, these are the 4,000 codes, so it's unlikely that they're going to go back to a prophy appointment. So do they need perio maintenance? Maybe they need 1 to 3 teeth of SRP, and now you schedule them. They're on the schedule for September, October, and you ask them, if we have a change in our schedule before September, can we call you and put you in? So what you do next is, if you have patient engagement software, this is your solution reach, your revenue well, your weed, etc. You put them, you want to be able to put them on a group scheduling, an ASAP list, and now you can text. The best way is to text message a group of people, letting them know we've had an opening in our schedule. Please call us to get you in today or this week, blah, 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 whatever is most appropriate for that opening. and now you can move that patient back up. There's a lot that I'm explaining to you. I do suggest that you click this button to schedule the revenue recovery session so I can customize this specifically for you, and I can make it super simple to show you who are those patients with one of the 4,000 codes that's been completed or they need to be scheduled, and they have restorative care. So when they come in to see doctor, they get their radiographs updated, a recent exam, and a diagnosis. Maybe they're going to be perio maintenance, but maybe they need SRP, and that's doctor deciding health or disease. Do they need 1 to 3 teeth? Do they need scaling and root planing of a quadrant or 4 quadrants or 2 quadrants? And now you're getting them on that schedule. You're also going to be able to reevaluate the restorative care, and as soon as doctor has an opening, get them back onto doctor's schedule. So there are many things that I'm telling you here. The best way to explain it and customize it for your office is if I can sit down with you for 30 minutes and explain this. But I hope that you can get your patients back on the schedule and give them the care they need. We don't want to see our patients just waiting and hoping that we can get them in the schedule. Many officers are saying we don't want to call our hygiene patients because there's nowhere to put them. And I've created this process so that you can call your patients and at least doctor can reevaluate their situation. Be sure to click, if you're watching on YouTube, click to subscribe because I have more information for you coming next week that will help you to optimize and create a productive hygiene department. I will see you on the other side of this video. Bye for now.